Pavitra, a lamaze certified childbirth educator from Pampered Moms. And today I am going to talk on a very important topic, that is the amniotic fluid. What do you understand by amniotic fluid? Amniotic fluid is that fluid which is present in the amniotic sac and it cushions the baby from all the stresses from outside. And what is the role of amniotic fluid? It supplies oxygen to the baby and it supplies all the required nutrition for the growth of the baby. So why are we talking about this topic? It is very commonly, this is the most common topic which most of the mothers hear from their obstetricians. They say either your fluid is too less, or your fluid is too low, or fluid is very high. So this is the most common topic which most of the mothers encounter, and it's a very scientific topic. So I am going to demystify this for you today. So how is this amniotic fluid formed? The inflow of amniotic fluid is usually from the lungs of the baby, the secretions from the lungs of the baby, and then urine of the baby. When the baby passes urine, about 600 ml of amniotic fluid is produced within the body, whereas the lung secretions account to about 350 ml of the fluid. And how is this fluid cleared out? It's either by swallowing or from across the amnion. So at any given point of time, the baby would be having at least 600 ml of fluid because the baby passes urine at a regular interval. So why are we so concerned about having low fluids or high fluids? Because amniotic fluid is the major source of nutrition for the baby and it is very important for the cushioning effect. So how do we determine the effect of amniotic fluid? How do we say that this is low and this is high? So how do we measure the amniotic fluid? There are two ways of determining the amount of amniotic fluid in the amniotic sac. The first one being AFI. AFI is nothing but amniotic fluid index. How do we measure this? You take around 4 pockets at different levels. You measure 4 different pockets directly going to the depth of it, and you measure the amount of fluid which is present in that particular pocket, and you didn't take an average. And the second method of measuring is maximum pool. In maximum pool, you just take one pocket, but you take the deepest one. Usually AFI, the index is usually 10 centimeters, that is considered normal. Anything more than this is considered as polyhydramnios, and anything less than that is considered as oligohydramnios. Oligohydramnios is nothing but low levels of amniotic fluid. And what is the impact on the baby? The baby's movements are slowed down. What do you understand by polyhydramnios? There is excess fluid compared to what is going to be normal. In polyhydramnios, you observe that the mother is edematic and then the babies are also a little bigger in size.